We're going to start first at 5:30 with another proposal to tackle the opioid crisis.
That's right. State lawmakers, they want to let doctors treat addiction with medical marijuana. But as our Jeff Preval tells us now, the medical field isn't entirely convinced that this is a good idea.
Cancer, Parkinson's disease, multiple sclerosis, and post-traumatic stress disorder are just some of the conditions that are allowed to be treated under the state's medical marijuana program. Under a bill proposed by Assemblymember Daniel O'Donnell, a Manhattan Democrat, opioid addiction would be added to the list.
I think that it's an excellent idea. I think that the risks of medical marijuana are relatively low.
Psychiatrist Jared Mashi is one of many doctors approved by the state to prescribe medical marijuana and thinks addicts could benefit from it.
A large portion of them have pre-existing psychiatric conditions, including anxiety and post-traumatic stress. So the idea being, if that is treated effectively with medical marijuana, the risk of relapse could potentially be less.
But Dr. Richard Blondell of UB's Department of Family Medicine isn't so sure.
My question is, where is the science that would support that? And the science is pretty weak. It would be appropriate to isolate these chemicals from marijuana one by one and evaluate them in clinical trials to see which ones are helpful, if any, and which ones are not.
Because it's federally illegal, it makes it very difficult to get funding to do clinical research trials, and because of that, there's very limited data as to whether medical marijuana works.
The other thing that's important here is to understand what's the difference between a short-term outcome and a long-term outcome.
There's a lot of unknowns, and if nothing else, I think the use of medical marijuana in this setting could help us to get some of that information.
Now, the bill passed out of the Assembly's Health Committee last week by a vote of 23-1, with local Assemblymen Ray Walter and Robin Schimminger voting yes. But it still needs votes in the full Assembly and the Senate, and we don't know if or when that will happen. Live in the studio tonight, I'm Jeff Preval, Channel 2 News.